Good afternoon.
Good afternoon.
Oh, you did my heart good. Thank you. Thank you. Thank you very much for that. My name is Dr. Joan Reed. I'm Dean for Diversity and Community Partnership at Harvard Medical School. And welcome. Welcome to this Equity, Social Justice, and Advocacy Award lecture and ceremony. And I'm so glad that you're able to join us today in person. It feels good from our first meeting. In our first ceremony, it was all on Zoom, and now we are able to see each other, and that's wonderful. But people are also joining us online, and thank you for being here. We come together to honor the remarkable individuals who are the recipients of the Equity, Social Justice, and Advocacy Award at Harvard Medical School and Harvard School of Dental Medicine. Our awardees are comprised of faculty, students, staff, and trainees, and their efforts reach beyond the constructs of their roles and concentrate on the array of areas needing focused attention. You hear more about what this means later in the program. Dean Daly was unable to join us today as he had planned. However, he sends his deepest apologies and heartfelt congratulations. You need to understand, I got a text like 11 o'clock last night. He seriously sends this for the awardees. And he extends his thanks to Dr. Thea James for delivering our keynote presentation today, which is our capstone. The Equity, Social Justice, and Advocacy Award represents how we aspire to excellence through a commitment to working together to serve our HMS, neighboring, national, and global communities, promoting diversity, equity, inclusion, and social justice, speaking up and empowering others to do the same, embracing innovation and understanding that creative solutions often require taking risks, and valuing the well-being of every member of the community. It's my hope that we are all inspired by today's activities and the work that these amazing individuals have done. A few housekeeping notes, particularly for those of us who are online. The chat function is not going to be available. Your microphones will be muted. We'll ask that you use the Q&A function to ask questions of our guest speaker, Dr. James. Live closed captioning is available for today's session. And at the end, please complete the poll. At the end of the webinar, please complete the poll for your feedback. And finally, this is being recorded and will be available on our DICP website. A little bit about the award. This is the third year of our Equity, Social Justice, and Advocacy Award. In 2020, 4 committees were charged with taking deep dives into the focus areas of diversity within the spectrum of Harvard Medical School and our community as part of our Better Together plan. One of those ad hoc committees was the Equity, Social Justice, and Advocacy Committee, co-chaired by Dr. Dwayne Pursley. Harvard Medical School Associate Professor of Pediatrics and Chief of the Department of Neonatology at Beth Israel Deaconess Medical Center, and Dr. Alexia Rouse-Boudreau, Harvard Medical School Assistant Professor of Pediatrics at Massachusetts General Hospital. I want to thank the ad hoc committee that had faculty, staff, student, and trainee representation for their developing this concept of what this award should be about. Their efforts continue to confirm the value of this award, and this year, nearly 100 nominations were received on behalf of members of our community. Each nomination was reviewed by the Award Advisory Committee and really represents a comprehensive team of community members. All of the nominations were compelling, and I have to honestly say it was a difficult and challenging decision to select the awardees for today. But they were compelling, and that is a testament to the dedicated work of respect, fairness, justice, and advocacy demonstrated by the nominees from a place of personal passion and commitment. So after this intense review and discussion, 11 awardees were recommended for this ESJ, Equity, Social Justice, and Advocacy Award. And we want to thank the nominators, the nominees, and congratulate each of the recipients. But before we go there, we're going to have a lecture. that honors a commitment to health equity and social justice advocacy. And it's my pleasure to welcome this year's speaker, Dr. Thea James. And I have to confess, I was talking to Dr. James, it's so hard because we've been Thea and Joan forever. And I'm like, I have to keep saying it's Dr. James. I have to keep saying that. And was it just on a call last week and someone said, do you know Dr. James? And it's like, are you serious? Right? Do I know her and do I know of her? And then when I just said this to you, what she said to me is, people may not know, if you go back 30 years ago when we were doing it, it was like, do you know these three people who are doing this work? And it is so wonderful to see how this has expanded. But Dr. James, Thea, has been in this space and has been a leader in this for forever. And she really exemplifies what excellence and what impact means in advancing equity. She's professor of emergency medicine at Boston Medical Center, Trevanian and Avidizian School of Medicine. She's vice president of mission and associate chief medical officer and co-executive director of the Health Equity Accelerator at Boston Medical Center. One of the things that our institutions do is, if you're really good, they just keep giving you more things to do. And she leads them all well. She's also director of the Violence Intervention Advocacy Program at BMC. Dr. James works with the Boston Medical Center caregivers and builds BMC's relationship and strategic alliances with local, state, and national partners to meet the full spectrum of essentials that enables patients and communities to thrive. The intentionality is to foster a strategic ecosystem of growth and economic inclusion. She's held several positions in her, I'm just going to go like this, because there's a whole bunch of years written here, tenure at BMC. Her passion is in public health, both domestically and globally. And she served during post 9/11 in New York City, Hurricane Katrina in New Orleans, Bam Iran after the 2003 earthquake, Port-au-Prince, Haiti after the earthquake in 2010. She has been wherever there was a need. Dr. James received a Doctor of Medicine from Georgetown University School of Medicine, trained in emergency medicine at Boston City Hospital, where she was chief resident. And she's joined us today to talk about equity-based healthcare, courage, intention, and transformation. My friend, my colleague, one of my sheroes, Dr. Thea James.
I am so honored to be here today. I want to say thank you so very, very much. I was stressing a little bit yesterday over, or actually last night over like what I should wear. And when I chose this, I got to the gym this morning and I had second thoughts. I was asking the girls in the locker room, what do you think? Harvard Medical School, what do you think? And they were like, oh, it'll be fine. Yeah, you're good. It'll be fine. And when I walked in the door, nobody gasped. So I figured it was okay. So, I want to share this information with you today with deep humility, because I want to say that we're on quite a journey and in a very nascent place on that journey. But I just want to share some early insights and some early sort of, I guess you might say, outcomes very early, because I think that it can be helpful to us. And so I'm just going to just get going and stop moving. Stop talking. So anyone who is, lives in the city knows these things about Boston Medical Center. You know that we are the largest safety net hospital in New England. You know that a majority of our patients are publicly insured, either Medicaid, Medicare, or uninsured. With most being Medicaid, we are among the top 20 institutions, academic institutions in the country to receive NIH funding for research. 1 in 7 Black births happen at our hospital, 1 in 13 Hispanic births happen in our hospital, and 1 in 100 white births happen in our hospital. And you know that Boston Medical Center, BU, is the academic teaching hospital for us. Something just came into my mind when I was thinking about this outfit this morning. I said, I was just tell them I'm from BU. It says BU, so that's what I was thinking about. So you know that when I talk about these things here, you already probably get an idea in your mind about who our patients are. And certain things will probably come to mind just predictably, if you hear of people that are majority people of color and, they are majority on government insurance. And also, by the way, we cover 40% of Medicaid lives in the Commonwealth. So, we have, quite a big job. And we're always, we've been creating all kinds of programs to address the issues that our patients have or the gaps that our patients have. And an example of that is, let's say Children's Health Watch, for example, which is focuses on research and policies. That was born in our pediatrics department. The Grow Clinic that, attends to kids who are underweight and undernourished. The Medical Legal Partnership Boston, and it's called Medical Legalship Boston because it started here in Boston at Boston Medical Center, and now it's disseminated across the country in other cities. And the Violence Intervention Program that we have at Boston Medical Center that basically sort of transforms kids' lives. I mean, altering their life course trajectory through trying to understand what the root causes are for them and, where they want to go. By the way, well, I'll tell that story later. Another example is Street Cred, which is an opportunity to engage with patients when they come in with their children for visits, where you can actually, get your taxes done for free and get financial coaching. And also, empowering families to define their health priorities and design their own care. We've been doing all these kinds of things for decades, but the data, these things here that you see, it doesn't change. Decade after decade after decade after decade, it never, ever changes. And so, pre-pandemic, I will say around 2017, we started talking a little bit about the root causes of why the data, these numbers never change. And, we talk a lot about redlining, and we see it as, I would say, an exclusionary economic strategy that has been wildly successful in delivering economic exclusion. And when something like that happens, you create two socioeconomic sort of pathways, and it just becomes self-perpetuating over time. And, without going too deep into, what the impact that redlining has had, it was a brilliant idea when President Roosevelt created it in terms of what his intentionality was to resuscitate America from the economic disaster of the Great Depression by creating pathways for people to build wealth through home ownership. And even today, that's the most common way Americans build wealth. But it was, designed for whites and not for people of color. And it's self-perpetuating. And it was all over the country. I mean, these red line maps here are just some examples of some cities where this occurred. But the thing about it is, these red lines can be really, really blurred. They can be really, really blurred because when you think about the things that are so predictable in certain populations, it becomes an expectation. It's thought of as the natural order of things. It's thought of as inevitable, and nobody questions it. And so it just goes on and on and on. And our idea of addressing these things usually is with charity or, some sort of subsidies. And what I keep thinking about charity is, if the state, for example, and Medicaid, we have I feel like our state government is very, forward thinking, but the dominant narrative about what's possible and what is the natural order of things or what can be changed, the dominant narrative makes people think you can't boil the ocean, is what folks say, and people don't really recognize that what we see was intentionally created, and so we can create an alternative. We can certainly create an alternative. And so that's what we have sort of been on a path to do. So what the pandemic did for us at BMC was, everyone was horrified by the pandemic, what it revealed, and all these other things, that were going on at the exact same time that there was such reckoning going on. But when everyone was stepping forward and making commitments to equity, we paused. We paused. We did not come forward, with a commitment or a statement of any sort. We just paused, and but not to do nothing. We paused to look under our own hood, to look inside our own house, and we kind of like had to take a really deep breath. The first thing we had to do was to create some ways of engagement, some guardrails, because we figured we would find things. But it's like, how would we react to that? And how would we engage with each other? And we decided that there would be no blaming, no shaming, but that instead we would support each other on this journey. I will say it came from the top. It came from the COO and the CEO. And they looked across the entire enterprise, including the health plan, all these areas you see here on the right. And even focusing on things when you look at determinants of health, not just identifying these gaps, they're there, but also focusing on, but interrogating the data we saw in each of these areas back to root cause, all the way back to root cause and making our intervention there. And so one of the things we talked about most in terms of determinants of health is, economic inclusion. We talked a lot about that, how to create pathways and opportunities for our patients to be financially secure. Because many times when doctors don't understand, when patients opt not to come to chemotherapy, in other words, they're really prioritizing survival over health. They're making very rational decisions when they only have limited resources. And it's like, no matter if we provide excellent care, it goes nowhere. It's just a vicious cycle. They come in unstable. We, work with them to treat them, sometimes admit them, discharge them. But what was not realized until like now, that we were discharging them right back to what was causing it. And the other thing, when we were looking under our own hood, we discovered that, we were complicit in some of these inequities. And so what became clear is, as my CEO at the time said, once you find inequities, once you see them everywhere. You see them everywhere. And so we were divided up into 8 work groups. And each work group was had an executive sponsor, and we had been charged with coming up with several, and a number that was manageable, several of the disparities that we had identified. We were charged with coming up with ways in which we were going to address them with an intentionality to close the gap. And whatever you proposed had to be vetted. It could not be something we've done before and just call it equity. Could not look like anything done before. And the proposal had to have something in it that had showed an intentionality to close the gap. We were held accountable. We had dashboards. We reported out, I say internally, but publicly. What I mean is that it was like a town hall, and you had to report on, what you were doing. And so it was a journey for us. It was absolutely a journey. I remember saying to a group myself that this is the first time I've ever talked about structural racism or said the word race out loud like this, because, had I said that some years ago, I wouldn't be standing here now. That's for sure. I would have been long gone. You're shut down. You can't do anything. And so that's kind of like where we started. And I would say, I mean, we still have these monthly, meetings and check-ins. And in fact, the new CEO, who was the COO before, when he sees the dashboards now, he was like, no, I think we need to do more because everything's green. We've like checked off every box, everything's green. So these are some of the areas that are included in the different work groups. So looking at human resources, looking at everything. People are really surprised what they found in human resources. But I can also say to you that if you're a person of color, it's the first thing you notice when you walk in any space. How many of you are there? That's something your mind just does. You don't even have to calculate. It's like your heart beats without you telling it to beat. Your mind just calculates that. And this breaks down the work groups a little bit more in terms of more granular, what kinds of things were included in these work groups. I mean, many of these things won't make a lot of sense to you, but the 1115 waiver is helping a lot because there are some things that it is going to fund us for that enables us to do the work. Thrive 2.0 in work group 3 here is basically right there. That's the screener we've been using since 2017 in Epic that screens patients when they come in for things they don't have and connects them to these things. We've now working on making it so that there's a feedback loop. So we have, two-way connections to understand what becomes of the recommendations and things that we make. Lots of advocacy always going on. I mean, when I'm sitting in a room or when doing a Zoom or when having a meeting, there's everybody there. There's the government affairs people are there, doing from their perspective and on any topic, they're going to be working on their end doing that. HR is there, doing their piece. The health plan is there. Everybody's there from where they sit, doing their part, and it's very strategic. And so, once we found all those things and set up this roadmap forward for the next 12 to 24 months, then we were like, well, what do we call this work? How do we operationalize this? How do we make it work? And so we were locked in a room for 2 days. I mean, of course, we got to go home and stuff and come back. But, for 2 days, for hours, we're in this room with a facilitator. And long story short, we came up with the name Health Equity Accelerator. And I'll explain to you in a second about how we came up with Accelerator and what that actually means. And it's basically having a just way or transforming healthcare to deliver health justice and well-being. And these clinical areas at the bottom were where we found the highest number of inequities, disparities when we looked in our own house across things. And when we started, it was just us. Actually, the director of research wasn't there in the beginning. It's just the 3 of us. And then we had an equity oversight group. These people are all either department chairs or vice presidents or senior vice presidents. And we still have equity oversight group meeting every single month. And those areas, again, are at the top, but the enablers, the things we were going to be addressing in each one of those areas, clinical areas at the top, are at the bottom here. And, we started with these boxes and, they were all quite empty. This is what the dashboard looked like. In the beginning, they had us blurring these things when we were on the road. I need to unblur it, actually. I've seen it elsewhere unblurred. I should just unblur it. But it's basically how they kept track of what we were doing and making sure we were on the right track. And, our CEO, he is a tough critic. He really, really is. And he's a guy who came from McKinsey, so he pays a lot of attention to detail and things. And so, but he's been, he's great. And now we have a team that's built out a lot more. It didn't all happen at once, it happened little by little. One of the things I want to highlight is under determinants of health. If you look at, so we have a Thrive manager, we have a housing manager, and a lot of people in this room might not know that the Boston hospitals work together a lot, with the Council of Boston Teaching Hospitals. We work together a lot. We just met yesterday. We meet every Wednesday, twice. once in the morning and an hour and a half in the afternoon. And I'm thinking about as I look at BOSS Collaborative. So the BOSS Collaborative grew out of a JP Morgan Chase grant we had that was focusing on, neighborhood revitalization and housing and all various different types of things. A lot of times when we apply for grants and things, the ink is never dry. The ink is never dry, which can frustrate some folks because once we decide what we're going to do, but we might think of something later after we get the grant or something pops up. Then we want to have the freedom to be able to like morph into take advantage of, what's out there, so it just works for us. So the BOSS Collaborative is a collaboration of Boston, some Boston teaching hospitals, city government, some other community-based organizations, all various types of things. And we meet monthly as well. And so that's how things sort of built out over time. And what I'm explaining to you right now all happened in a year. This is from 2021 to 2022. Now these things are populated, and guess what? They're also outdated, the numbers. They're higher, for sure. But just to give some examples, the one thing we incorporated in this that we had not done before, usually if you're trying to solve a problem with patients or whatever, we take a committee or a group of people, we go in a room and we sit down and figure out how to solve the problem. Well, we don't know. I remember the first mistake I made when I got promoted to a vice president job. I went in a room. We had a vice president's operations meeting every Friday, and they were running dashboards. And they were running dashboards and said, "Oh, we're doing well in this area. Could do better here. Doing great here." And they got to the no-show rate, in a clinic, and they were like, "It stays red. We just can't seem to move the needle on the no-show rate." And my mind is just sitting there thinking, I'm fresh out of the ER. We are just raw. We don't have a lot of whining and dining and things like that to do to present things. Not a ton of formality. And I just raised my hand and I just said, "Has anyone asked the patients?" And the room went, and I'm like, "Oh, that wasn't the right question, or certainly not the right way to ask it." And I learned a lot from that. So now the long story short is we start with the patients. We start with the community. We have a problem, we ask them. We did that with COVID and it helped us to, target that population and vaccinate them at 4 times the rate of the state, just by asking the patients. Our strategy teams and operations teams were out in the community, walking around with leaders, looking at buildings and sites and trying to figure out, what should this look like? What should it feel like? How should it operate? Did that together and it worked very well. So now we start there. And I'll give you another example of that at some point as well. Only other thing I'll talk about here is under SDOH is another grant we had targeted 7 zip codes we serve. And we said, we will hire 52 people in 1 year, in year 1, into living wage paying jobs. Well, you can see what the number was, and actually it was higher than that. That's how many we got in that first year. And where the research department is all built out, we give out grants. And here's the thing about grants. So we give out quarterly grants, and then we give out a larger annual grant. And the grants had to be around equity, like closing disparity gaps, addressing inequity. And I actually always think it's better to call it inequity because that way it's hard to go wrong, And so in the beginning, I think it took about 3 rounds of submission for people to really start to understand, what we were looking for. In the beginning, it was the same thing that we'd done before, but they were submitting it as an equity grant. And then finally, we were holding office hours and things and helping people. And now, they're well on their way. So everyone knows this. You all know that. So I'll give you an example of the model we use to interrogate disparity data back to the root cause and then make an intervention there. So at our hospital, this is what we found with Black women having postpartum hemorrhage at higher rates than white women. And the OBGYN department led this work. and they decided to interrogate the data. They interrogated this, and the first thing they found was that it was associated with preeclampsia mostly. And of course, you know, the treatment for that, particularly at a later stage of pregnancy, is to deliver the baby. But then they saw in the data that the sooner that decision to go to C-section was made, the less likely this outcome happened. And then they interrogated the data more and saw that the doctors were taking twice as long to make that decision in Black women. So what they did immediately was to standardize the decision-making protocol. They just stopped it right there and just, you know, standardized the decision-making protocol. And you know, you can imagine what that led to. The gap closed up just doing that. At the exact same time, though, we had a qualitative component to it, where we were interviewing the doctors, interviewing the nurses, everybody, and the patients, everybody involved in the process, to add context to the quantitative data. And it was incredible. I mean, it was really insightful. And actually, talking about difficulty in finding out things, when we would have these big Zooms, town hall like Zooms, and there would be slides up there one at a time of quotes from patients talking about their experiences. I mean, it was so quiet, it was loud. Such an uncomfortable moment for people to see these things that the patients were saying about their experience with us. And so, but the doctors were incredibly transparent as well. In fact, if you look at this analysis here and the data people, I don't even know how they do this. I really don't. But, you know, if you see in the center of their, right there, you know, bias was, you know, a big piece of all of this. And the doctors were open about it. They were really open about it. And, you know, and you know, there was mistrust on both sides, doctors, patients as well. But it was incredibly helpful because we used what we found in the quantitative data to make the intervention beyond just giving parameters around how the decision-making process happens. And so the patients were saying things like, they didn't know anything about preeclampsia, you know, they wish they had a chat bot, you know, they wish they had educational videos and things like that. And so the first thing we did is to do remote blood pressure monitoring. So now the patients, the pregnant women are followed 24/7. And when something's not right, you know, we can contact them and get them to come in because they have lots of other competing priorities. And they just can't come in any time. We co-created a chatbot with the patients. We also created educational videos, which were incredibly, if you saw them, you would be like, yes, these were made by the patients for the patients, because they're very, very clear and they're very, very informative. And then in the OBGYN department, they are creating a culture of anti-racism. And they're very, very active in that space, I would say. And this is what's happened a year later. You know, the postpartum readmission rate has gone down, and that decision to incision rate has also been closed. They just published on this very recently. So, you know, what I would say what this all took was a willingness to be vulnerable, a willingness to be transparent, and a commitment to organizational transformation. And it's been an interesting journey, but again, some early indications that maybe, you know, we're making some strides. Just wanted to talk just a little bit about doulas. Now that Mass Health is going to reimburse for this workforce, you know, just having someone who you trust, someone who shares your lived experience, someone who's there for you whenever you need them. You know, the impact, if you look at the data here, the impact of having doulas is incredible. We've had them since, I think, 1996 and 97, but now we want to quadruple the workforce. And now that, you know, we're going to be reimbursed for them. But what I would say about, you know, this transformational stuff is like it translates into, you know, saving lives. I mean, there's real outcomes for this. So I just want to talk a little bit more about the sort of ecosystem that we focus on, particularly around economic mobility and economic inclusion. We belong to an organization called the Healthcare Anchor Network. Other hospitals in Boston do as well. And their intent is to build more inclusive, sustainable local economies by hospitals being intentional about how they hire, invest, and procure. And here are just like 3 examples of, how we've, done that. Nubia Markets, I don't know if you've seen it in the news or YouTube or on TV or whatever, but it's gotten, quite a bit of press, I would say, over time. But this came to be, again, we're SafetyNet Hospital. We do not have some portfolio of, there's nothing on our balance sheet that says this is designated for investment. It doesn't work. It's not possible. But I was talking about the state and, how forward thinking the state can be. When a hospital in Massachusetts builds onto its facility or even gets new expensive equipment like an MRI, the state requires you to give 5% of the total cost to the community. And in 2017, we did a campus redesign and we had $6.5 million to spend. Now, you hear some people talk about how, your mom could make $1 out of 10 cents and this kind of thing when you're growing up. And so, we invested in a lot of different things. Now, that's $6.5 million. I compare that to some of our colleagues that we're at the table with, like at the same time, Children's had a DON, we call them the DON, determination of need. Theirs was 53.4 million at the exact same time. And thankfully, we all work together. So we're kind of aligned in how we make these investments. And right now, MGB has one for 69 million. And again, we are aligned. We work together. I mean, I've talked to their community advisory board about stuff. We work together very, very well. So in the beginning, this market was going to be, we were investing in some housing in Bartlett Place, mainly because, it has very, very specific things that have to be met in terms for in order for a developer to be funded. And so, this required people to whatever they proposed had to provide access to green walking space, transit, healthy, affordable food, affordable housing. And so that was that development. But on the bottom floor, there was space for businesses like this one. And so it was going to be, belong to some owners who are in Washington, D.C. We thought they were good because they actually they teach community people how to be entrepreneurs. And when COVID happened, the market was built out, but it didn't open. And then when it did open, they said, we can't come to Boston. It didn't open yet. They said, we can't come to Boston. It's too dangerous. And so they said, we'll hire you a couple of local operators who they found, who are 2 Black men who have a lot of history in this space and have their own businesses. They had no interest in being operators. They wanted to own the business and the physical space because that's how you build wealth. And so it took us 16 months of being at the table with the other investors in the capital stack, but they ultimately gave in. And those guys are now owners. And the story is incredible. It celebrates the African diaspora. They're very intentional about the supply chain in terms of who their vendors are, farmers are, and that type thing. And the reason we did this is because banks don't really want to. They're not that interested in making loans to businesses like this in that neighborhood, and they'll do it, but at high interest rates and really untenable repayment terms. And so we gave them a no interest loan. And we also gave them very patient repayment terms. And that's how that was able to happen. And there up in the right-hand corner, there's City Fresh Foods. They've been in business for well over 20 some odd years. They feed elders, they feed children's, and their rent increased by 150%. And they wanted to purchase a building, that building right across the street. But again, we wanted to buffer, the loan. And so we we call Children's, we call the city of Boston, we all put in patient types of capital, and they actually got the building. Not only that, they got a $17 million contract for Boston Public Schools. And so that turned out well. The other thing we like about them is they have equity stock ownership for their employees. So the employees are also owners. And the last thing in terms of procurement is we chose a Black developer, Southern Middlesex Industries, to build this mental health center in Brockton, where a majority of the patient or the population there is Black and brown. 60 some odd % of the hires to staff that facility come from the community. So we can add to that economy there, and it's carbon net zero. So it doesn't harm the environment there as well. So that's about the kind of intentionality around hiring, investment, and procurement. We worked with it. This slide here should be talked about by our Vice President of Community Engagement, but she's made all these relationships with people in the life sciences to create jobs for these for community members. I don't even know if I'm going to go through this slide because this is my CEO's paper she wrote. And these are the things that she said she learned from the pandemic. And so I don't think I'm going to go through them all. I mean, they are kind of self-explanatory. But I will say, and again, with deep humility, this is what we're trying to do, like rewrite health, rewrite what we've been taught in medical school as physicians about how this is supposed to be done. Throw out this notion of you can't boil the ocean. Every time somebody says that, my body boils, because I'm like, why are you saying this? It doesn't have to be that way. But anyway, that's all I have today. Thank you so much for sitting here listening.
Amazing. To me, an example of what is possible, We have a few minutes that we could take a few questions or comments. Would anybody like to ask a question? Raise a comment.
Hi, my name is Vikram Patel from the Department of Global Health and Social Medicine. What an incredible talk. Thank you so very much.
Thank you.
I wanted to ask you about that amazing experiment, or rather that amazing real case study you had about reducing the time between the decision-making time. I wondered, to what extent did your qualitative exploration unpack why was there a much longer time for women of color to get to that decision in the first place?
How they got to that decision? I'm sorry. I'm sorry.
Sorry, I was gobbling my question. Why was there a longer period of time in the decision making in the very first place?
Right. So some of the things we uncovered, or that OBGYN uncovered in the qualitative work, was that there was mistrust. The doctors had ideas and preconceived notions about what patients would understand, what they would do, whether or not it was worth it or whatever, that last notion, I'm sort of, is in my own mind. But the other things that I just stated, for example, like the trust, and are things that they uncovered. And the patients also said they didn't trust the doctors. They didn't trust that the doctors had their best interests. And also the patients were, not informed about these diagnoses and why it was important for them to, because in many cases, it's the first time they were hearing about it. They didn't hear about it early in their pregnancy or anything like that. So it was difficult to make an informed decision, compounded by mistrust. And I think it might be important just to lift one thing up around the trust and how it's not obvious all the time. So everyone in this room knows what patients and what neighborhoods were going to do worse during COVID, right? But when the vaccination sites came out in Massachusetts, that's not where they were placed. That's public health 101, I think. And so when that happens your whole life, you're not going to trust these things. And that's an example of the type of thing that's just not obvious to people in terms of inequity.
I'm going to piggyback on that and ask you, since you standardize those decisions for preeclampsia and going straight to C-section, has the hospital standardized any other medical decisions for outside of OB/GYN because you saw such an improvement and closure of a gap?
So not yet, because I don't think that they've identified. I will tell you some things they have identified. They haven't identified anything that would, maybe I should answer that yes. Okay, so when I think about it, because one of the themes that we have found in every clinical area is delayed diagnosis. Delayed diagnosis. And so, we have standardized when people, how doctors ask these questions and identify people. Not only that, remember I was saying it took 3 rounds of grants submission. Now the grants are doing that stuff. They're studying those things. And so, which has been really, really helpful, extremely helpful.
One last one.
Thank you. I provide mental health services in another county in Florida.
Yes.
And I get referrals from Medicaid patients all the time. And I was wondering why I was getting so many Medicaid referrals as opposed to others. So I asked, and some of the patients told me simply, well, they only provide 2 mental health professionals out of all that they have. So they had no choice but to come to me.
Right.
I was wondering, is there any way we can mandate people with medical licenses, or in my case, a mental health license, that if they want the license, one of the precepts would be you must take a certain number of people under Medicaid.
Right. On Medicaid. Well, it's interesting. So you're talking about people who don't take Medicaid as insurance for patients. Yeah, listen, I tell you, that is a hard one and that's something that can't be undone, by the way. And I'm saying it's a hard one because I've seen exposés and things like one big one in the Globe, about things like why certain, and I'm talking about commercial insurance here, will charge 2 different hospitals, same procedure, and they'll pay one, at full reimbursement, and the other one, like, I don't know, 50 cents on the dollar or whatever. And they get, and it's because they can. I will also say, we could do a lot better in mental health, a lot better. The capacity is not there. Part of that is reimbursement also in terms of the rates they paid, and even, how they reimburse providers as well. There's a lot more that could be done. I think mental health should be deemed, foundational for people to actually be able to thrive. Just yesterday, we were, when I say we, I belong to Health Equity Compact, as does Joan. And, it's a bunch of leaders, like 80 leaders in Boston, who are actually trying to move health equity together. And we were testifying at the State House yesterday about operationalizing and establishing health equity as in the State House, like a secretary of equity, for example. And that's a person who would take care of and have eyes on and intentionality around things like mental health. And so it's a good question, and it's intersectional. When people, when they can't take care of their health, this is a stressor for them. That's that kind of thing. And then it becomes a vicious cycle. They can't take care of themselves. They get stressed about it. Then their condition gets worse and they get more stressed about it. Those things cause shorter life expectancy and all kinds of things. So I think mental health is something that we have a lot of room to move on, but I'm really hopeful if we get this bill passed, that we'll be able to address that.
Thank you very much. I wanted to thank you. For me, what you presented is thrilling. And I want you to think about the time frame for what got presented. This was not over the past 10 years we did this. And for me, it is a call for us to understand that we should be questioning our assumptions. We make so many assumptions about it's this way because it just is. And there are reasons, there are political reasons, there are economic reasons, there's historical reasons for what we see. And how do we unpack that if we're really going to make a change? So I think this is exciting. For me, in an academic environment, some of us have been working at this for a very long time. It is my hope that the students who are coming in and the individuals we train will listen to us, ignore us, and say, we can make a difference and do something different and challenge us and think differently. And think not in terms of just what our institutions can do, but what we do with community and how community and patients can help guide us and steer us better. So I thank you for your example. I thank you for what you have been toiling in this space for such a very, very long time. And it's wonderful to see the changes that are there. And now I'm going to turn to our Equity, Social Justice, and Advocacy Award recipients. And for us, this is a way for us to acknowledge the fact that we have many champions in our community. Champions who've been doing this kind of work and hidden, and we didn't know about it. But it is so very important. It's consistent with our school's mission and our community values and who we are and how do we raise this up. Contributions to our mission, to our how we think of ourselves as a profession and as an organization. As I mentioned earlier, an advisory committee carefully reviewed the close to 100 nominations that came in, and I'm now going to present the awardees that were put forward. I have these careful instructions that are written here. Teresa Carter and my team in my office is very good about making sure that I don't stray. So it's like in red. It's not even just written. It's like red. Read red. Okay, all right. To the award recipients and presenters, I love it. I will introduce a recipient and a presenter. And when you hear the award recipient's name, both the award recipient and the presenter, please come forward and stand in front of the table to receive the award. They are explicit. Okay. And then you're going to have your photograph taken, and then you're going to come to the podium to offer some brief remarks. I'm not joking. This is like, don't say just this. Okay. So as we begin, it's my pleasure to introduce our first faculty ESJ awardee, Dr. Yarden Freeman, a medical school, Harvard Medical School instructor in pediatrics in the Department of Pediatrics at Beth Israel Deaconess Medical Center. Please look at, he heard me, he's coming forward. And Dr. Freeman is being introduced by Dr. Dwayne Pursley, Associate Professor of Pediatrics and Chair of Neonatology at BIDMC. Just get a picture. I couldn't make it up. I don't like being pictured.
Come towards me a little bit just to the projector screen.
All right, everybody else watch. You're practicing for the academy. You never know.
Very nice. Okay. Very nice. Last one. 1, 2, 3. Thank you. Well done.
Please prepare written remarks to ensure, oh, sorry. Dr. Freeman is a neonatologist trained in health services research and public health who focuses on the modifiable drivers of perinatal, neonatal, and pediatric health inequities. His identity is a first-generation Latino American, a grandchild of Holocaust survivors, and a gay man informs his strong commitment to health equity. He's tireless, and his impact is impressive. Over the last 2 years, he's contributed 16 peer-reviewed publications to the pediatric health equity literature, half as first author. Through his leadership, he's established a longitudinal anti-racism and health equity curriculum for fellows in our Harvard-wide neonatal perinatal medicine program. He's created, and led mentoring programs targeted at URIM students in Boston high schools and colleges, as well as for Harvard medical students and trainees. At BIDMC, has led multidisciplinary efforts to embed a culture of equity in our NICU with highly effective staff education and interventions to provide more equitable support for our vulnerable patients and their families. Dr. Freeman is truly deserving of this recognition. It's my great privilege to present him to you.
Goodness. Thank you, Dwayne and Dean Reed, to the Equity, Social Justice, and Advocacy Award Committee, and thank you, Dr. James, for your inspirational words. I did part of my pediatric training at BMC, and the lessons and experiences I have, I carry them with me. And again, congratulations to my fellow awardees. My imposter syndrome is so strong right now. As Dwayne mentioned, I'm the grandchild of Holocaust survivors who survived the concentration camps and went on to build their lives in South America and hope for a better world. And I'm the child of 2 Latino immigrants here today who came to this country in search of higher education. I am a product of their hard work, and I carry the legacy of their resilience as well as hope in my veins. This work, the work that we all do to promote and advocate for equity and social justice, is hard work. I want to take a moment to recognize that. It can be scary, it can be isolating, and it can be risky, especially for those of us that already feel othered. And yet, to be recognized by HMS for this work, to be told that this work is important and belongs, is monumental. How many of us have just wanted to know that what we believe is important, actually important? And yet, we are all working in a sea with tides that run toward us and raise us up, and at times try to pull us down. As Daniel Dawes outlines in his book, The Political Determinants of Health, there is so much work to be done. Health equity is the unfinished business of our society, he writes. It is work that must continue, especially in light of the current backsliding of support for the work that we all do. Let this moment be a moment of building community together and remembering the teachings of the Alter Rebbe, a late 16th century Jewish scholar who taught that only a little light is needed to dispel much darkness. Let us continue to work together and be that light, not only for the populations and the people we serve and work for and with, but also for each other. Thank you again to Dean Reed and HMS, to my mentors. I stand on their shoulders, to Jonathan Litt and Dwayne Persley and Megan Sandell at BMC. And most importantly, to my husband, te quiero. Sos mi luz. I could never do this without you. Thank you for being in this ocean with me. Thank you.
Thank you, and congratulations. Our second faculty recipient of this year's ESJ Award is Dr. Rosanna Means. Dr. Means is Associate Professor of Medicine at Harvard Medical School, Department of Medicine at Brigham and Women's Hospital. Dr. Means is being introduced by Dr. Catherine Rexroad, Professor of Medicine and Chief of the Division of Women's Health at Brigham and Women's. So Grayson passes it to me so I can pass it there.
Yeah. let me see. Just a little bit of that direction. One, two, three, one last one.
For more than 40 years, I'm getting all tripped up. Dr. Means has served the Brigham, Harvard Medical School, and local community in advancing social justice. In 2016, Dr. Means created the Bridges to Moms program to assist individuals who are pregnant and experiencing homelessness or housing insecurity. Using a community health worker-based, trauma-informed model, the program addresses key social determinants of health, including housing, transportation, food security, and personal safety. The program has shown exceptional outcomes for the more than 500 women it has served, 90% of whom are women of color. And it has resulted in improved maternal and infant outcomes, reduced NICU stays, and high rates of follow-up for the comorbidities these individuals experience during their pregnancy. It is also focused on long-term economic stability through job training programs and following the family through at least 1 year. Dr. Means has been a powerful and effective voice, educating government and health policy leaders in Massachusetts and beyond about the impact of homelessness, resulting in meaningful change and commitment of dollars to making change. In short, she is a tireless advocate for more than 4 decades who has advanced health equity and justice. It is truly an honor to present her with this award.
Most of the time, I'm actually not a good girl, but today I did write out my words and I timed them to be 1 minute and 7 seconds or whatever it was. Thank you, Joan. Thank you, Dr. James, Dr. Reed. This has been a really wonderful honor for me. And thank you, Dr. Maxwell. I'm not going to be able to get past that. Okay, so for more than 40 years, I have practiced both mainstream medicine and cared for homeless women in Boston through my nonprofit. In 2016, I did start Women of Means. I started Bridges to Moms at the Brigham and Women's Hospital. This is a program that closes gaps in social determinants of health for pregnant women who are housing insecure, hungry, and alone. Over 600 have been served to date. 95% are women of color, not a single maternal death. We follow the women through the pregnancy and the first postpartum year, connect them to primary and mental health care, and steer them towards education and skills development. We physicians are a human passport that carries compassion, concern, and kindness to our patients. Whether we do this in a bamboo hut 10,000 miles away, on a sidewalk in Boston, or in a slick state-of-the-art medical facility, we honor each person's health journey and treat them with dignity and respect. Thousands of patients have blessed me by putting their trust and faith in me. I am deeply grateful for that honor and very much appreciate HMS for recognizing my commitment to those values that have shaped my 40+ year career. Thank you.
Congratulations. Our final faculty awardee is Dr. Martha Publicus, Associate Professor of Medicine at HMS in the Department of Medicine at the Israel Deaconess Medical Center.
I was instructed that I had 1 minute. I've timed this 12 times. On behalf of my colleagues who joined me in nominating her for this award, including her division chief, Martin Pollack, who is here, it is my great pleasure to introduce to you Dr. Martha Pavlakis. Dr. Pavlakis embodies the Harvard Medical School's values of equity, social justice, and advocacy in her everyday activities. As a transplant nephrologist, an educator, and a researcher at Beth Israel Deaconess Medical Center, as an associate professor of medicine in the Harvard Medical School, and as a member of the larger community of transplant professionals nationally and internationally. Dr. Pavlakis has worked tirelessly for many years to reduce gender and racial inequities along the spectrum of kidney transplantation, locally, regionally, and nationally. Most recently, as one example, she led the effort to successfully eradicate a major structural and deeply rooted racial barrier to kidney transplant access. This barrier seriously delayed diagnosis and treatment of kidney disease for Black Americans across the country. What she has done in removing this barrier to transplant access represents a seismic change in transplant policy and practice nationally that will undoubtedly save and improve thousands of lives. I encourage you to ask her about this policy change during the reception this afternoon. Dr. Pavlakis, on behalf of everyone in the Transplant Institute, your colleagues in nephrology and the Department of Medicine, and those patients who will benefit from your commitment to equity, congratulations for this highly deserved award and recognition. And it's my pleasure to introduce you here today.
Thank you very much. I want to thank the organizers, our special guest today, the audience, my family, loved ones, colleagues who are here today. I appreciate it very much. There were two main initiatives that I undertook to the national policy level, founded on the work of my colleague, Dr. Melanie Honig at Beth Israel Deaconess Medical Center. The first was to disallow the use of the race-based kidney function measurement in determining access to the kidney transplant list, which, as you mentioned, delayed access for Black and African American patients. The second was to provide some relief to those patients on the list or who will be listed in the future whose access to transplant had been delayed by this race variable. As of a few weeks ago, out of the 30,000 kidney transplant candidates who are Black or African American on the national United States list, about 10,000 have had their priority on the list adjusted up to reflect to improve their waiting time to get them transplanted sooner and alleviate the influence that these race-based equations had on their transplant candidacy. The race variable in kidney function measurement is part of a long tradition in medicine of a collection of poorly substantiated assumptions about the biological nature of race that have lingered in our collective medical thinking, often with very harmful results. We have to continue to work to remove race-based barriers to equal access to care, to provide restoration of access to care when those barriers have impacted it, and to prevent new barriers from being introduced going forward. I thank you all for this award, for the kind words, for your attendance today, and for all your hard work in this space. Thank you.
Congratulations. We have two student recipients for our 2023 award. And each pair worked in tandem in their efforts to effect change. Our first duo of student recipients graduated in Harvard School of Dental Medicine class of May of 2023, Dr. Laura Piscara Colomb and Dr. Jordan Middleton. Dr. Colomb is now a periodontics resident at the University of Illinois, Chicago, and Dr. Middleton is an oral maxillofacial surgery resident at BMC at BU. Dr. Colomb will join us by Zoom. Dr. Middleton took the time to pre-record remarks. But we have with us today Ms. Sarah Petrokis, Director of Admissions at the Harvard School of Dental Medicine. Ms. Petrokis, please join me at the podium.
I
Here we go. Here we go. Another one, 1, 2, and 3. Right this way.
Hi, Laura. I'm not sure where the camera is, but. Okay. Hi, my name is Sarah Petrakis. I'm the Director of Admission at Harvard School of Dental Medicine, or HSDM, as we call ourselves. And Martha Vidrina, our admissions coordinator, and I nominated Laura and Jordan Middleton. I actually, we nominated them together, and my notes are combined too. So maybe that gives me 2 minutes. I'm not sure. So we nominated them both for the Equity, Social Justice, and Advocacy Award, and we're so pleased that they are receiving it. And I'm really grateful to be able to tell you about more about the big role in promoting diversity at HSDM. Laura and Jordan were DMDs in the class of 2023, so they recently graduated. And they worked very closely as a team for all 4 years that they were here to support the Office of Diversity, Inclusion, and Belonging, and to support admissions as an ambassador for both. Prior to the pandemic, when DMD interviews were held in person, Laura and Jordan would pick up our interviewees and take them out for a coffee excursion. Right then and there, it was so nice. And later, when they were held online, because of the pandemic, they contact them via email or phone and to introduce themselves and provide a point of contact for them, which was great. They even made their own welcome video for our students, which was very much appreciated. It's still up there actually on our Canvas website. It's a couple of years old now. And then once they were admitted, the students, they would contact them and offer their congratulations and answer any questions they may have about being an HSDM student. Then back in September 2022, the admissions and the Offices of Diversity, Inclusion, and Belonging held 3 webinars for 3 historically Black colleges and universities. And these webinars generated over 100 attendees, including pre-health advisors. Laura and Jordan participated in these webinars and provided really valuable student perspectives for prospective applicants, which we're continuing to build our relationship today. And then in the 4th year, both Laura and Jordan served on the admissions committee. They interviewed DMD candidates, they participated in committee discussions, they voted on candidates, and directly helped shape the classes that were coming in. They're really impactful. We're so appreciative of all their help and really proud of what they accomplished at HSDM. They played a big role in increasing the number of matriculated URIM students over the 4 years that they were here. And they really established a recruitment model for us that's a gold standard going forward. And we miss them already, but we're excited to see what they'll accomplish as alums. And thank you, Laura and Jordan. Congratulations, best of luck, and we hope to see you soon.
Thank you so much, Sarah. So I am extremely honored to have received this recognition from the HMS and HSDM community. When I started dental school in 2019, I ecstatically anticipated meeting people who were similarly ambitious and passionate about dentistry that shared my cultural and ethnic background. I felt that the lack of diversity I encountered was because the students at the time didn't sufficiently advocate for change within the school. My colleague, Dr. Middleton, and I felt empowered to have conversations with admissions, the Office of Diversity, Equity, and Inclusion, as well as with other faculty administration at the school, because we felt that we could elicit a change. HSDM was very receptive to our concerns and very supportive in implementing these efforts. Over the course of the 4 years, we significantly increased the population of students who identified as Black and Hispanic. And by the time we left, the community that we created was the one that we wish we had been received by when we entered HSDM. We all must take the responsibility to change our communities. There are many wonderful people in this community who are friends of our cause, but it takes somebody who's committed to action to be the catalyst, and we can all be this person, right? So my personal philosophy is that if not you, then who? Thank you so much.
Hey everyone, sorry I couldn't be there with you today. I really would have loved to have seen the folks from HSDM and HMS at the ceremony. Unfortunately, by the time you're watching this, I'm probably pulling someone's tooth or doing some other intern duty that's keeping me from attending today. But I am grateful that you're giving me the opportunity to share my thoughts and accept this award virtually. So thank you for that. And of course, thank you to the Equity, Social Justice, and Advocacy Award Committee for the nomination, both myself as well as my classmate Laura. You know, I think over the last 4 years at HSDM, we were able to do a lot of really great and important work with the help from Dean Ginobili, Sarah Petrakos, Dr. Coleman in the Office of Diversity, Inclusion, and Belonging. I think from when we started to when we finished, the school looks and feels a lot different in a good way. And, you know, I think that's truly a testament to the school giving the students and faculty and staff the resources to implement the change that, you know, we all hope to see within HSDM. And, you know, of course, none of that could have been possible without them. So I thank you very much for this nomination. And again, I'm very sorry I couldn't be there today to celebrate. Bye.
You heard this. He's over at BMC pulling a tooth. You heard this. Our second pair of student recipients is Ms. Hillary Nguyen and Dr. Kevin Salinas. Dr. Salinas is a 2023 graduate of HMS and is currently an intern at the John Peter Smith Hospital in Fort Worth, Texas. And Ms. Nguyen is an MD candidate in HMS for the class of 2024. Dr. Salinas and Ms. Nguyen will be introduced by Dr. Sophia Cameron, Assistant Professor in Radiation Oncology at MGH. Dr. Cameron, please join me at the podium.
All right. Thank you, everyone. So I'm very honored to be here today. I'm a very proud mentor right now. So I'm honored to introduce both Hillary Nguyen and Dr. Kevin Salinas today. So I am a radiation oncologist at MGH. And as I said, I'm a very proud mentor. So I'll first introduce Miss Hillary Nguyen. So Hillary's currently away on an away rotation at Sanford, but we look forward to having them return to Boston very soon. So Hillary is from a family of refugees displaced by the Vietnam War. It is evident that she carries the resilience of her parents who did not have the opportunity to go to college, and these experiences clearly influenced her goals and dedication to the first generation low-income student community. I first met Hillary back in 2021 after she co-founded the HMS First Generation Low Income, or FGLI, student group here at HMS in conjunction with Dr. Kevin Salinas. This community has been seeking visibility for years, as it is often overlooked. I've been proud to partner with both Hillary and Kevin to serve as faculty advisor. Hillary has worked to promote an inclusive and safe environment for fellow FGLI students, and this group in turn has grown to span multiple HMS classes and close to 80 FGLI students. In addition, Hillary has worked passionately on projects to support and promote this identity beyond HMS, namely collaborating with Kevin on a book chapter specifically on FGLI medical students and physicians as part of an initiative to increase physician workforce diversity overall. This book will be disseminated to medical school admissions offices around the country and will be an invaluable resource for admissions committees going forward. I'm excited to see her continued contributions to the FGLI community throughout her career. It is also my pleasure to introduce Dr. Kevin Salinas. Dr. Salinas graduated HMS in 2023, is currently an intern in Texas, but will be returning to MGH soon for his diagnostic radiology residency. So we eagerly await that return. So Kevin is the son of an HVAC technician and homemaker from a Spanish-speaking household in South Texas. His challenges also clearly informed a lot of the work he has performed together with Hillary to co-found the HMS FGLI student group. I similarly met Kevin back in 2021, and we worked together on that book chapter I just referenced. He and Hillary have continued to work on scholarship in this area, first publishing a survey on the diverse FGLI identities within HMS, and many viewpoint perspective pieces on why recruiting and increasing the visibility of socioeconomically diverse healthcare providers will help address known current health disparities. Building community at HMS and promoting the identity beyond the HMS community will go a long way in working toward dismantling health inequities for patients from lower socioeconomic status backgrounds. I similarly look forward to watching Kevin flourish and his continued work in this area in residency and beyond. So I'm very honored to be here and happy to introduce you both to them.
And now we turn it to you.
Great. Hi, hello. Can everyone hear me okay?
Yes.
Amazing. Great. I really wish I could be there. Honestly, just being connected, I felt so a lot of nostalgia for the Boston days. Luckily, they'll be coming back to me really soon. So I just wanted to thank Dr. Cameron and everyone else involved in planning and making today possible. It's honestly a really rewarding experience. I'm deeply humbled to be present before you today, although virtually, as a recipient of this award. It honestly represents a lot more than my individual challenges and efforts. It represents to me the collective power of first-generation low-income individuals as we work together to build community, uplift each other, and reshape the landscape of our profession. It also serves as a reaffirmation of the values that underpin HMS, as well as our shared commitment to creating a more equitable and just world. As FGLI individuals, many of us navigate intersectional identities that include other challenges posed by our gender identity, sexual orientation, race, ethnicity, disabilities, or religion, to name a few facets. And through difficult times, we have not only supported one another at an individual level, but also worked tirelessly to raise awareness at the institutional and national levels about our unique challenges and injustices that we face within the medical profession, whether they be related to financial barriers and stressors, the hidden curriculum, cultural fit, a need for relatable mentorship, or our what I call multiplicative vulnerabilities resulting from our intersectional identities. And these are important early challenges to address in order to ultimately build a thriving workforce that can optimally serve and care for communities of lower socioeconomic status. So thank you for recognizing our collective efforts. I can't accept this completely alone. It really does take a village. And may we continue to work together to ensure more equitable conditions for trainees and underserved patients alike. So thank you.
Hi everyone, my name is Hillary Brenda Wynn, and I am a fourth year Pathways medical student at HMS. Unfortunately, I'm currently on an away rotation in California, but I truly wish that I could be present with you all this afternoon. I just wanted to share that I am so honored and grateful to receive this award representing the strength and growth of our first generation low income or FGLI community. I am also so thankful for the support that I have received from my fellow FGLI medical students, including the newly minted Dr. Kevin Salinas, as well as my mentor, Dr. Cameron, for being alongside me every step of the way. This organization was built around 4 years ago when those of us from similar backgrounds organically came together to support and advocate for one another. Our goal is to bring greater visibility and resources to students from disadvantaged socioeconomic backgrounds. Coming from a family of refugees myself, and being the first in my family to attend both college and medical school, I have seen the challenges faced by my community in accessing healthcare. This drives my work with the FGLI community and inspires the care that I will provide someday as a physician. Thank you again for uplifting and supporting this mission, and I look forward to returning to HMS soon and continuing our work together.
Thank you. It's my pleasure to recognize Ms. Meredith Solomon, our staff recipient of the Equity Social Justice and Advocacy Award. She's Manager of Outreach and Public Services right here at the Countway Library. And Ms. Solomon's award will be presented by Dr. Elaine Martin, Director and Chief Administrative Officer of the Countway Library. Please come forward.
So it gives me great pleasure to introduce to you Meredith Solomon. Meredith has been the Outreach Officer at the Countway Library of Medicine for the last 5 years. She is an active member of a variety of groups working in the areas of equity, social justice, and advocacy within all 3 professional schools on the Longwood Medical Campus. She's been a member of the Harvard Chan Dean's Advisory Committee in Diversity and Inclusion since 2020. She has helped to promote diversity and inclusion at the medical school by serving as a member of the Black Staff Caucus and helping them arrange events held at the Countway Library. She's also served on the HMS Student National Medical Association, the HMS Student Council, and the HMS Office of Diversity, Inclusion, and Community Partnership to create a more inclusive and equitable environment for all members of the HMS community. In addition to her work with these organizations, Meredith helped to write and submit a Harvard University Library ADIBA internship proposal and has led the Countway Black History Month Advisory Group since 2019. She has served as a member of the Leadership Council for the Joint Committee for the Status of Women since 2018. She has served as a member of the HMS Office of Student Affairs Anti-Racism Subcommittee and the HMS DCIP Juneteenth Programming Committee. In addition, she worked with Dr. Potter on creating an LGBTQ curriculum for the medical school and helping us provide library resources to support that community. Meredith has also worked on improving access for those with disabilities. She was the Countway representative to the groups wanting to host disabilities in medicine and dentistry working group events. And in 2021, she worked with faculty member Dr. Dorothy Tolchin to create a poster exhibit titled This Is Me to honor Disabilities Awareness Month at Countway, as well as a co-sponsor for Countway Cinemas, the events that highlighted disabilities such as hearing impairment, deafness, and autism spectrum disorder. But most of all, for those of us who know Meredith, she has a great heart. She really cares about the employees and making this a better place for all of us to work. So it is my great pleasure to introduce to you Meredith Solomon.
I kept it short. Thank you again, everyone involved in this award. I am humbled to receive such an honor and to be amongst some really great other recipients. I knew I wasn't going to make it without this. First, I want to thank Elaine Martin, Director of Countway Library. Without her support and trust, the work I do with our student groups, the Black Staff Caucus, the DICP office, and the creation of other mission-driven initiatives, none of my work would be possible. To my nominator, wherever you are, thank you for acknowledging me and believing in the work that we do, and I look forward to working with you again. I also want to thank Harvard Medical School, Harvard School of Dental Medicine for their continued support of Countway Library and the work that we do. You're gonna get me crying in pictures. Oh my goodness. And finally, I want to thank my family, my mother, my father, my sister, who are here in the audience, for their constant support, love, and belief in me and the work that I do. Thank you all.
It's now my pleasure to introduce our 3 trainee recipients. Our first Equity, Social Justice, and Advocacy Award is presented to Dr. Demetrice D. Jordan. I'm like, who is this Demetrice person? All right. I'm sorry. Your family may be on here going, how could she be? All right. Dr. Jordan was a Dean's Postdoctoral Research Fellow from 2020 to 2023 and is now an instructor. She has moved from fellow to faculty. Come on. In the Department of Global Health and Social Medicine. Dr. Jordan is founder of the Advancing Geography Through Diversity program at Michigan State University. She is on a quest to increase the number of diverse students in graduate geography programs nationwide. And this program, AGTDP, is the instrument that she's been using to move this forward. The program was founded in 2017 by then doctoral student D. Jordan, and is a nationally recognized cohort-based program that seeks to address the persistent underrepresentation of minoritized U.S. citizens who are African American, Hispanic American, and Native American in geography graduate programs. The organization addresses these concerns through active recruitment, financial and well-being support, campus and community engagement, and intentional retention work. It was launched with its first cohort in 2018 And to date, with these efforts, there have been 11 graduate students admitted to the MSU Geography Department, exceeding the department's past representation. Since 2020, the program has graduated both master's students and 3 PhD students. And currently there are 6 scholars in residence and 3 new admitted students prepared to start this academic year. She's been involved through the entire programmatic life cycle from conception to inception to implementation. The itemized list of tasks is extensive and touches every aspect of the program, and her work has been recognized by the American Association of Geographers through a seed grant to support scholar needs. Dee Jordan, join us at the podium.
Hello. I greet you this afternoon extremely grateful and honored to receive an Equity, Social Justice, and Advocacy Award. As an activist scholar, this award validates my strong belief that it is our moral imperative to be the change we wish to see. I'd like to thank Dean Joan Reed for her visionary leadership. She cares deeply about posterity and has dedicated her life's work to its prosperity. The team at DICP for believing enough to take up the mantle for those visions to help bring them to fruition. My esteemed colleagues in the Department of Global Health and Social Medicine, my postdoctoral mentor, Dr. Matthew Bonds, Jen Pachetti, Dr. Alan Brandt, Rebecca Groh, Michelle Joseph, and the late Paul Farmer for pouring into me so mightily over the past 3 years and giving me wings to soar. My friends in the Black Doctoral Association, the Office of Postdoctoral Fellows, and Harvard Chan's Office of Diversity and Inclusion for their unconditional acceptance and support. A very special thanks to my son, Ashton Jordan, for being my North Star, my beloved grandparents, Louis and Lulabelle Jordan, who told me never follow where others dwell, create my own path and leave a trail. The rest of my biological family, chosen family, my wonderful friend group, the Advancing Geography Through Diversity Program scholars at Michigan State University, Drs. Joe Dart and Ashton Shortridge for trusting my big ideas and joining me on the journey for their fulfillment. As Dr. James has shared, inequity will not reverse itself. So we must be intentional and bold in the pursuit of what's fair and just. If we are ever to see the day when justice rolls on like the river and righteousness flows like a mighty stream. Remembering that other people's destinies are bound in the decisions we make and the actions we take. Therefore, we must be purposeful in our pursuit of equity, deliberate defenders of social justice, audacious in our advocacy. It has been said that our living is our giving. So give generously of your time and talents. Give tenaciously to causes that change the lived experience of others. And give mindfully and boldly to our youth, for they are the future. May our collective actions illuminate the path towards justice for others to follow. Lastly, in the words of Dr. Ruha Benjamin, the author of Viral Justice, remember and imagine and craft the worlds you cannot live without as you dismantle the ones you cannot live within. Thank you.
Our next trainee award recipient is Dr. Anna Sophia Karansi, clinical fellow in surgery in the Department of Surgery at Beth Israel Deaconess, who's being introduced by Dr. Evangelos Marazis, Associate Professor of Surgery in the Division Chief of Colon and Rectal Surgery at Beth Israel Deaconess Medical Center. It took all this time. And she raised no longer handed to me.
It's an honor today to present to you Dr. Anna Sofia Ore. Before I start that, on behalf of the Department of Surgery at BIDMC, I would like to thank everybody in this room for all the efforts they have done for equity, justice, and social justice. Before starting, I want you to give your attention to three numbers. BIDMC, in the last 4 years, has increased by 247% the underrepresented members and trainees in their staff. That happened under the directorship of Dr. Ore in the Council of Diversity and Inclusion. Second number I want you to pay attention to is the 150 international candidates that came for research from other countries. They came to BIDMC, and 90% of them either got an advanced degree or ended up matching for residency in the United States. Even the 10% that returned back to their countries, they returned with the skills to perform research there. This has happened again under the leadership of Dr. Ore as the director of the International Research Initiative. And finally, I want to talk about her effort to open and establish essentially a Latinx colorectal surgery clinic. This started almost a year ago. We have already provided care in 100 patients, and it has changed the landscape in regards to the care that we provide in underserved populations. The ultimate goal for this is to improve the outcomes for these patients. Today, it's an immense honor for me introducing to you a true visionary and leader in the realm of medicine and surgery. She stands as an inspiring beacon in the Department of Surgery with a transformative power of inclusivity and mentorship and cultural competence in medicine and in surgery. Her tireless work shattered barriers in the Department of Surgery, transformed lives of patients and faculty, and forged a future in the surgical field that is more diverse and equitable. Remarkably, she has achieved this within 4 years, and I think that is a great accomplishment. Dr. Ore, I truly anticipate to see what you're going to do in the future and change and touch so many lives as you have touched till now. Thank you.
Thank you. I am honored to receive this award today, and I would like to extend my sincere thanks to Harvard Medical School, the Office for Diversity, Inclusion, and Community Partnership for recognizing all of our efforts. Today, I want to emphasize the importance of representation in the field of medicine and specifically surgery. Only 6% of physicians in the US identify as Hispanic, and only 1% of academic surgeons identify as female Latinas. Ensuring that our healthcare system is inclusive and that all patients, including the Latinx community, have access to care that understands and respects their unique needs is extremely necessary. That was our vision when creating the Colorectal Surgery Latinx Clinic. Language concordant and culturally competent care is a fundamental right that every patient should have. None of this would have been possible without the guidance and support of some incredible individuals. The whole team working to launch the Latinx Clinic, my mentor, Dr. Mesares, along with the support of the Department of Surgery, Dr. Olvesky, and the Office for Diversity and Inclusion at BIDMC. I also want to thank everybody at the International Research Initiative, which is the research organization I head at BI, in which we bring international medical graduates and give them the opportunity to have research and then launch their careers in research and in medicine. Lastly, but certainly not least, I want to thank my family for their love and encouragement throughout my career. I am committed to using this recognition as a stepping stone to continue advocating for representation and culturally competent care in surgery. Thank you.
Our final trainee recipient is Dr. Hamayal Sana, Research Fellow in Global Health and Social Medicine at HMS in the Global Surgery and Social Change Fellowship. Dr. Sana has been an advocate for meaningful engagement of youth in public health decision-making and implementation for over 5 years, achieving exemplary wins for young people, women, and people of color from all over the world. In 2021 and 2022, Dr. Sana convened the Youth Pre-World Health Assembly, resulting in the establishment of the World Health Organization Youth Council. The Council is a first ever youth decision-making body for the World Health Organization. Dr. Sana developed the action of the WHO Youth Council to bring the issues of marginalized and vulnerable communities to mainstream discussions to inform policy change. Through this work, she is establishing partnerships with member states of WHO, thereby building a network of allied countries that are committed to youth excellence and partnership to achieve health for all. In addition, Dr. Sana contributed to the WHO launch report on the social determinants of health to highlight the lack of access to equitable care of people of color and youth from disadvantaged backgrounds. These 4 accomplishments only scratch at the surface of what Dr. Sana's efforts have been and the impact that she has had. Dr. Sana.
Thank you so much for this great honor. It is monumental and means so much. So I want to thank the Howard Medical School community and the Office of DICP for recognition of our efforts. As Dean Reed said, 40% of the world's population identifies as young people. But in our education, none of us get the fundamental knowledge of how policies and decisions are made that change our lives and help us become productive individuals of this community. I saw that need and I worked towards it in my own small community in Pakistan. And I want to thank my mother for that because it was her who showed me the resilience and the values that should never be compromised on. And she pushed me to be my best self. And it brought me here to this community of the Harvard Medical School and most importantly, my community of global surgery and social change at Department of Global Health and Social Medicine. My mentors are here supporting me again, as they have been doing over the course of the last year. So I want to thank Dr. Ranganathan, Dr. Scott Corlew, Dr. John Mira, Dr. Menon Pijole, Dr. Robert Riviello, and so many other people who have inspired me and showed me what a great leader can be and what a great mentor can be in shaping you to be your best self. And I also want to thank my friends because as being a young person in a small community, we very rarely get the mentorship until you are at the point where you understand that this is what I want to do. But it takes a friend to understand, even when you don't know what you want to do, to be able to tell you that we love you for who you are and you should be able to do that. And I want to thank all of my friends. Some of them are here in the back taking relentless pictures of me to make this memory last forever, and some others who are just doing amazing work in their own communities. And it is my hope and my dream that I keep working towards it, be a great care provider, be a good policymaker, and be a good human to understand people's problems and work towards it. Thank you so much for this honor again.
Congratulations. What I'm going to ask is for those who are still online, the recipients, to turn on your Zoom so we can see your images. And would all the recipients please come forward so we can take a group picture.
All right, thank you.
Thank you. So each of you are faculty, students, staff, and trainees. As a community, we say thank you. Thank you for your foresight, insight, and drive, your determination to correct injustices when and where you see them, your vision for equity, your heart for justice, and your conviction for advocacy. To all of our attendees in person and online, these are our 2023 Equity, Social Justice, and Advocacy Award recipients. One last round of applause for everyone. Within our community, we stand secure in our mission and guided by our community values as we raise our voices in support of advocacy, equity, social justice. We're charged to nurture a diverse, inclusive community dedicated to alleviating suffering and improving health and well-being for all through excellence in teaching and learning, discovery and scholarship, service and leadership. And what we have seen today is that together we can make a difference, that we can change the world around us, be it close and right in our department or our institution, or reaching across the world. It's a sign that we truly are better together and what we can accomplish together. I thank you, Dean Daly, for providing the foundation for this work, to our medical school and School of Dental Medicine community and our affiliate community for accepting this charge, to Dr. Thea James for her motivating presentation, for Teresa Carter for all that she does to keep us on track. To HMS Media Services and staff who made all this work. And to all attendees here and online, thank you. Please join us for the reception.